Hey everyone, I want to talk to you about iodine today. Iodine is a trace mineral that I think we hear very little about, and when we do hear about it, it's very closely associated with the thyroid gland. And obviously, that's I think what most people know iodine for. So iodine is very necessary to help in the production. It's used in the production to make the two thyroid hormones, T3 and T4. And so iodine has a very important role in regulating thyroid function and can, in deficiency or excess states, impact thyroid function. What we're seeing, however, in newer research is that iodine seems to impact fertility outcomes independent of its relationship with the thyroid. Now, if you've been following our research posts and blog posts, we talk a lot about the thyroid function as a critical player when it comes to supporting pregnancy and helping to reduce miscarriage rates as well. So the thyroid in itself, when it produces T4 and T3, is absolutely essential because it helps to regulate so many important functions related to fertility, from helping with hormone production, helping with ovulation, potentially having a role in implantation, and then supporting that pregnancy as well. So the thyroid obviously has a big role when it comes to supporting fertility rates and also miscarriage rates. However, iodine deficiency, even if we're having normal levels of thyroid hormone on blood tests, may independently affect fertility rates. So this is really cool because up until now we've only really looked at iodine as a supportive trace element really for the thyroid. And so what we're seeing is that the endometrium and the ovaries will actually uptake and absorb iodine as well. So it seems to have a role in various mechanisms and functions to support the lining and potentially ovarian function and health as well. So, um, you know, what other things does it impact? Well, there was also a research paper published that found iodine supplementation or iodine levels are strongly associated with sperm health and sperm parameters as well. So it seems to impact both ovarian fertility and also sperm fertility. So when it comes to actual numbers, because this is I think where we start to really evaluate the weight of a treatment and its impact on fertility outcomes, obviously. So the most recent research paper that looked at this was a Norwegian observational study. So they followed a large group of patients, and basically what they found was by using the World Health Organization's recommended daily allowance. So the amount of iodine someone should be having on a regular day is 150 micrograms a day. And so this is for anyone of reproductive age from 15 to 49 years of age. And if that patient is pregnant or lactating, they recommend 250 micrograms a day. So what happens when patients are below the recommended daily allowance of 150 micrograms? So they compared patients, for example, that had on average about 50 micrograms of iodine intake a day, and compared to patients that had 100 micrograms, the group with the 50 micrograms per day actually had an increase risk for having unexplained infertility by about 14%. So they were 14% more likely in that group to have delayed conception. So that would, in the study, translated to basically they tried for 12 consecutive months to have regular intercourse and were unsuccessful. And in the group that had 100 micrograms, they were more likely to see that. And then they went a little bit closer. So they said, we have one group that takes 100 micrograms a day of iodine, and we have a group that takes 75 micrograms of iodine a day. And how do the fertility rates differ there? And it was a difference about 5%. So the group that took 75 micrograms a day seemed to have a 5% higher risk of basically being diagnosed with infertility, where they're trying for 12 months or more unsuccessfully to try and conceive on their own naturally. So this seems to have a very interesting impact, and with the combination of other studies also looking at how iodine seems to impact ovarian health, endometrial health, seminal health, we're seeing that it can impact various, areas and important components that are required to support fertility. And when we look at fertility, we have to consider like the anatomy of the entire path that's going down. For example, there was a research paper published a couple months ago, and what they found was that using a specific medication, a common antidepressant actually, seemed to negatively impact fertility rates, not because it impacted egg quality or affected implantation, but it actually affected the motility and mobility of just the fallopian tube. So, sometimes we don't necessarily look at these impacts when they're contributing to infertility. When it comes to unexplained infertility, we try and look at anything that we're missing, anything that is present in the case, the scenario, the lifestyle, the diet, and the medications that may be contributing to the unexplained infertility. And I will clarify, from this study that looked at the role of this antidepressant contributing to potential infertility, they still recommend that patients continue with antidepressant medication, obviously, because the negative impacts of suffering from depression during fertility treatments and during pregnancy in itself has been shown to have such a negative impact on fertility outcomes and overall well-being. But it was just an important understanding that sometimes things that we wouldn't consider may actually be having an impact, and iodine is like that. So it seems to have an impact on other locations and sites in the reproductive organs where we may not have been considering, traditionally just associating iodine with thyroid function. So when we look at iodine levels, this isn't something that's fully eradicated either. So we still see that iodine deficiency can be prevalent even in high income countries and low income countries. And part of the issue is that certain dietary regimens, particularly dairy-free, low-meat diets, which have in their own been suggested to support fertility in certain studies, actually have a deficiency in amounts of iodine. So, there are very simple tests that can be done to help assess your nutritional status for iodine, and the World Health Organization actually measures deficiency or sufficiency using a urine test. So that's a very easy method for us to help determine how much iodine the body has. And the reason for that is because iodine, the majority of it is actually excreted through the kidneys and the urine. So we'll catch all the iodine that's coming out, or the majority of it. So we will be able to assess basically, if a patient has very low iodine levels in their body, or if they have normal or very high levels of iodine, which is also has a negative impact on fertility outcomes. So they also saw when patients were taking too much iodine, it actually decreased fertility rates just as if they were taking too low or too little iodine. So we really have to try and find that sweet spot, and it seems to be around that level recommended by the World Health Organization for 150 micrograms a day. If you're trying to conceive, and then once patients are pregnant, they recommend increasing it to 250 micrograms a day. If you have any questions about what we're talking about today, drop us a message or send us a message in our inbox. And as always, we're always happy to get back to you. Take care, everyone.